Welcome, and many thanks to each of you for taking time out of your busy schedules to join us for this series, Finding Hope and Meaning Through Stories During the COVID-19 Pandemic. We'd like to get started by having our esteemed panel introduce themselves. Helen, can we start with you?
My name is Helen Haskell. I am a longtime patient safety advocate. I came to this 20 years ago with the death of my son from medical error. I have worked in almost every area of patient safety, but the main thing I do is patient advocacy and patient engagement.
Thank you for joining us, Helen. Glad to have you here today. Crystal Morales?
Thanks for having me. My name's Crystal Morales, and I serve as the Senior Director of Education at the MedSTAR Institute for Quality and Safety. I'm also the Program Manager for the Executive Masters in Clinical Quality, Safety, and Leadership at Georgetown University. Thanks for having me.
Thanks for all you're doing at the front lines, too. Welcome, Josh WEISSBURG. Would you like to introduce yourself?
Yeah, thanks for having me. I'm Josh WEISSBURG, and I'm here, I guess, representing the patient role today, week 6.5 of COVID. I'm a recovering software entrepreneur, and now I invest in and advise some technology companies.
Thanks for joining us today, Josh. Looking forward to your experience, firsthand experience with COVID. Next up is VONDA VADEN. VONDA, welcome.
Hi, thank you for having me. I came to patient safety in 2012 after my beloved husband died from a hospital-associated venous thromboembolism in a Minnesota hospital. And as a result of that, I've become very passionate and I would say almost completely distracted by trying to do everything that I can to improve medical safety. And one of the things that I'm doing currently is traveling by car, not by feet, to Capitol Hill and interviewing people about their experiences, both those who are trying to help with safety in medicine, as well as those who have experienced it, and bring those stories to legislators so that they can do something to help support that. I'm also the CEO of 10th DOT, the company that my husband founded 40 years ago. Thank you.
I think driving across country during a pandemic is pretty brave.
Or crazy.
Yeah, well, it's all for good. I love what you're doing, bringing the stories to light as well. I think that's important, and that's why we're here today. Thank you. Tim McDonald, would you like to introduce yourself? Welcome.
Greetings, everyone. My name is Tim McDonald. I'm a physician and an attorney who's worked at that interface between patient safety and medical liability for the last 20 years or so. One of the things I've really been pleased to do is work with a lot of people that are here today on the creation of a comprehensive, principled, and systematic approach to preventing and responding to harm, known as CANDOR, Communication and Optimal Resolution. I currently serve as the Chief Patient Safety and Risk Officer at RL Datix, and I'm also on the faculty at Loyola's Law School, teaching future lawyers about the importance of empathic communication following patient harm.
Thanks, Tim, for taking time out of your busy day. I know you've got a lot going on, and kudos to you and Dave for being at the beginning of this movement. Next up is Pat Merriweather. Pat, can you introduce yourself?
I'm Pat MERRYWEATHER-ARGES, and I'm Executive Director of Project Patient Care. I have years of experience, but over 30 years of experience working in healthcare with the Medicare QIO, the Hospital Association, and also internationally working with Rotary International. I think there's many opportunities that we have to improve healthcare, and I'm in it for the long run because I truly believe that the continuum of care is the long run, and that's where we need to be.
Thanks for that, Pat. Thanks for joining us as well. Next up is Steve Burrows from California. Steve, would you like to introduce yourself, please?
My name is Steve Burrows, and I am the writer-director of the HBO documentary Bleed Out about my mom, Judy Burrows, who 10 years ago went in for a routine partial hip replacement and came out in a coma with permanent brain damage. And our film is about our journey as a family and fighting for her justice and accountability, transparency, and it's an honor to be here.
Thanks, Steve. Joining us from California also is Margo Burrows. Margo, would you like to say hello?
Hi, I'm Margo Burrows, a producer of the HBO documentary film Bleed Out. I'm also married to Steve Burrows, who is the writer-director of the film. It documents his mother's 10-year journey through the nightmare of medical error, and we each had different, very separate experiences, but we worked together, and it actually drew us closer together through this. I was working in green energy, trying to keep the home fires burning in Los Angeles, and wanted to make sure the world knows about medical error. And thank you for having me.
Thanks for joining us, and also thanks to you and Steve for putting that film out into the public domain. It really recharged our patient safety efforts and our work here, so we appreciate you both greatly. Next up is Dave Mayer. Dave, will you introduce yourself, please?
Greetings, everybody. My name is Dave Mayer. I serve as the Executive Director of the MedSTAR Institute in Quality and Safety, an organization I've been with for over 9 years now. I previously served as the Vice President for Quality and Safety across the MedSTAR system. I also serve a volunteer role as CEO of the Patient Safety Movement Foundation. It's a global organization in 50 countries and in over 4,800 hospitals across the world with a mission of zero preventable harm.
Thanks, Dave, for joining us. And again, you're known as the guy walking the country, right? Until people pay attention and really solve this problem. Thanks a lot, and thanks for all you're doing. And thanks to this panel for taking 90 minutes out of their busy days. We're only touching on all the accomplishments collectively that this group has done. So I'm just so grateful that you're all here. And please reach out to share stories of your own at pleaseseeme.com or to the Center of Healthcare Narratives at the MedSTAR Institute for Quality and Safety. Take good care.